watching the recording when it is uploaded. Thank you all very much for coming. This is once again another weekend, and we have an amazing specialist, not new to us. He is very regular on this channel. I'm once again Dr. Albesedo here, your host of the Weekend Health Talk. And today we are blessed to have a brother, a friend, Dr. Daniel Amewonu, a physician specialist who is currently on transit to Holy Family, but currently he's at Kolebu Teaching Hospital. Yes, Department of Medicine and Therapeutics. We are glad to have him join us once again to share with us freely on the topic diabetes. This is quite common. Most people who have hypertension, last week we had a talk on hypertension. Most people have hypertension. Some of them have diabetes as well. So we want to know more about it. And who better than the physician specialist himself? So please join me welcome a brother, a friend, Dr. Daniel Amewonu, to go into detail for us all. And when we are done, you have any questions, you feel free to ask. Doc, over to you.
All right, thank you very much, Albert. Give me just a few minutes to project it, and then you let me know whether you can see my slide. I'll try and put it in the slide. Let me see.
Yes,
can you see it in the presentation mode?
Yes.
All right. Okay.
So go ahead.
All right. Thank you very much, Albert, for your kind words and then the introduction. And this afternoon or this evening or morning, depending on where you will listen to this recording, it's my honor to do the presentation. Again, we're supposed to do this presentation last week together with hypertension, but I felt it was two topics to be dealt in one day. And so today we're going to talk about diabetes. Silent killer. We talked about hypertension last week as a silent killer. Yes, diabetes is also a silent killer. And like the presenter said, Albert, I mean, this is quite common. Either the one listening to it, you have it, or you have someone in your house, or you know a friend who has this diabetes. People have a lot of perception about diabetes. Are they really true? Or there are some correction that we need to make. So it is an honor that I'll be presenting on this topic this afternoon. And the outline for the presentation is going to take an introduction, we'll look at the burden of diabetes, some causes and risk of it, then we'll look at the diagnosis management, and then we look at some myths about diabetes, as well as make a quick summary of it. Now, as part of the introduction, in preparing this slide, I remember this story of one of my patients where he was told that he was diagnosed of diabetes, okay, and that he was advised to take bitter leaf and take things that are bitter. And the rationale being that once you take those things, because once you take those things, they are not sweet, and so your sugar level would not go up. But it's important to know that no matter what we eat, whatever we eat, whether bitter, sour, sweet, once it gets into the stomach, the body has a way of converting it or changing it into a form that the body recognizes and uses. And that form is what we call sugar, okay, or glucose. Everything that we eat, it needs to be converted to, in the stomach, into glucose, or in a layman's term, sugar. Okay, these are the airs that are in the stomach. And now this sugar or glucose need to move into your bloodstream. So what we see over here is like your arteries where the sugar is moving into. And you need to do this to get to every part of your body from head to toe. Now, when it gets to where it's supposed to act, for example, when it gets to your brain, now this sugar needs to get to the powerhouse, okay, where this sugar is now converted into energy. And it's that energy that we use in our day-to-day activities. Now, that sugar cannot get into the warehouse if it doesn't have this key that is attached to it, all right? If it doesn't have this key attached to it. And this key that is attached to this sugar is a very important key that we call in medicine insulin. It's just a chemical that needs to be attached to that, okay? So that once it gets to the house, it can get to where the sugar is needed and broken down to provide energy. But there are times that, this sugar that this insulin that is being produced, the body is unable to produce it. Okay, so when you see this red code, the body is unable to produce it, and so you are not having this insulin, you are not having this key to go and open the door for this sugar to enter, and so you have a problem. This sugar now accumulates in the blood. Okay, and once that accumulates in the blood, the sugar level goes up, and that is what we call diabetes in a sense. And so there are different types of diabetes, and this particular one where the insulin or the key is not being produced by this organ in your body, then it's called a type 1, okay? There are sometimes that the key is being produced or you have the insulin. However, when it gets to the house, because so many things have happened over here, one way or the other, the lock gets defect in it. And so the key is unable to work. The key is unable to open it for the sugar to enter the cell or to enter where energy needs to be produced. And so that also causes a problem. This sugar that is running in the blood also accumulates, okay, gets higher. And that is what we call type 2 diabetes, all right? Now, globally, the diabetes is increasing. Okay, if we look at this chart, it is just to tell us that the different regions in the world, the number of people that are living with diabetes. And if my concentration here will be on Africa, Africa seems to have the lowest number of people living with diabetes compared to other regions. But it is very important to know that the rate of increase of people who have diabetes is very, very high in Africa. And we'll look at those ones subsequently in the slides or during the presentation. And globally, if it takes about 10 people worldwide, at least one person will have diabetes, okay? And it is estimated that by 2045, the number of people living with diabetes likely to rise from about 500 million to about 800, okay? To about 800 million by 2045. And this is huge, all right? Now, of those living with diabetes worldwide, if you take 4, 3 of them are likely to be in low and middle income country, where we call them developing country. 3 of the 4 are likely to be among those people. And every 5 seconds, there is somebody in the world that is dying out of complication of diabetes. So I've shown this slide. This slide has been on for maybe the past 6 seconds. It means that one way or the other, somebody in the world somewhere has died because of diabetes and its complication. And this last point that I want to make is that over 500 million people or 500 adults have what we call pre-diabetes. This is impaired glucose tolerance. What it simply means that you have pre-diabetes. You have your sugar levels that are high, but it is not to the level that we can say that, okay, this is diabetes. But these people are at very high risk of developing diabetes. And this number is huge. And so there are things that people can do to reduce their chances of progressing to become diabetic. Now, what is the history or the story in Africa? If we take about 22 people, one of them is likely to be living with diabetes. And this is what I was talking about. By 2045, the number or the increase in the number of people with diabetes is estimated to be about 129%. And this is higher than any other region. Other regions, you may have 25, 26, 37, but Africa seems to have the highest. Even though it has a small number of people living with diabetes, right, the rate of increase is very, very, very high. And people need to be aware of that. Now, of those living with diabetes, more than half of them are not aware that they have diabetes. Okay, and so that is why we probably say that it's a silent killer, because you may have it once it's not diagnosed, you're unable to tell, and it can cause havoc. It can cause a lot of damage to our body. Okay, but in 2021, okay, it was estimated that close to about 500,000 deaths occurred in Africa as a result of complication diabetes. All right, 1 in 8 live births, every birth that is given, 1 out of 8 will probably have issues with high blood sugars. All right. Now, what is the story in Ghana? Not much is found in Ghana, but just to mention that diabetes is a major cause of blindness, kidney failure, heart attacks, stroke, and then limb amputation. I may put those in red. Last week, we looked at hypertension, where it may cause kidney failure, heart attacks, and then stroke. And this is just to buttress the point that diabetes and hypertension are bedmates, and their risk factors are almost the same. Okay, so this diabetes can cause what hypertension does, in addition to diabetes leading to blindness and then causing lower limb amputation. So it is very important. Aside this medical condition, it has economic burden, because once somebody has diabetes, there needs to be someone who's taking care of them. Their care in hospital is very expensive, so it has economic burden for us all. Now, I mentioned earlier on the types of diabetes, okay, but I think with this slide, what I needed to stress on is gestational diabetes. Type 1 diabetes, we've mentioned it already, where we said that the insulin is not being produced at all. Type 2 is that the insulin is produced, but it is not working very, very well. Now, gestational diabetes is usually diagnosed in people who are pregnant, usually from the second trimester or after 12 weeks. After 12 weeks onwards, your sugar levels may go up. And so one may be diagnosed of having gestational diabetes. It is just because of the pregnancy and because of some hormones that are being produced, your sugar levels may go up because they oppose insulin, okay? So your sugar level may go up. Usually after delivery, your sugar levels may come back to normal, but your chances of developing diabetes, proper diabetes in future is very, very high. If your sugar levels are high before 12 weeks, we don't say that that is gestational diabetes. It probably means that you have the diabetes already, but you didn't know about it. These are the 3 main types of diabetes, okay? But just to let us know that there are other types of diabetes, which we'll not deal with in this presentation, but subsequently. Now, what are the causes or risk factors of diabetes? Like we mentioned for the hypertension last week, there are things that you can do something about, and there are factors that you cannot do anything about, okay? So the non-modifiable, you can modify, you can change it. If you have a family history of diabetes, especially you have your mom, your dad, your siblings, okay? These are first degree relative. If they have diabetes, the chances of you having it is high. It doesn't mean that you would definitely have it. And now if you are 45 years and above, it increases your chances of having it. Some races, African American, Asian American, are also seems to have a higher chance of having diabetes. If you have a history of gestational diabetes, which I mentioned in the previous slide, okay? And then if you have pre-diabetes, your chances of developing a frank or proper diabetes is also there. Now, these modifiable risk factors are not new to us, okay? Physical inactivity, being overweight, unhealthy eating, taking in a lot of saturated and trans fats, okay? Smoking, and I mentioned last week, especially secondary smokers as well. Excess alcohol intake, okay? High blood pressure. I mentioned this, how high blood pressure may increase your risk of developing diabetes, and also make the point that diabetes, hypertension are bedmates. Once you have one, the probability that you will have the other one is high. All right. And then when your cholesterol level is high, yes, that is also a risk factor. And then some medication, especially those who take in a lot of steroids for whatever reason that they are taking it, yes, it may increase your chance. And then oral contraceptive. Now, this slide that we are seeing here is it looks quite busy, but I'll point one or two things that I think we should bear in mind. Of all these risk factors, okay, they lead to some changes in our body that leads to our sugar levels being high. This slide may be for those who need details, who need much information, but I just want to stress on where there is decreased insulin secretion, okay? The insulin that needed to be produced, the effect of this risk factor is that you're having this insulin reduced, and so you will not have the sugar being pushed into the engine house where energy is produced. Or you have the insulin produced, but it is not working effectively, okay, at the engine house. So the sugar is not able to go there to produce energy. Or you may have other chemicals within the body, other chemicals within the body that are opposing or that are working against insulin. Okay, so these are the three ones that I think we need to bear in mind. But those who want more information, they can look at this subsequently for if they so wish. Now, what are the symptoms of diabetes? Most people may not have any symptoms. If you are fortunate, all right, you may have frequent urination, and not just frequent, you realize that the amount of urine that is coming is a lot. You are urinating frequently, or you feel very hungry often, okay? Whilst you're feeling hungry and you eat, you realize that you are losing weight. You are eating a lot, but you are losing weight. It should probably point to you that maybe you may have diabetes, or you have constant thirst. Your throat gets dry, small, you want to take in water. Even in the night, you wake up several times to take water. This is different from people who voluntarily take in water, okay? But this one, you feel your throat is dry, you need to take in water from time to time. Probably that is a symptom of diabetes. And then you feel tired, you feel worn out, even though you have a lot of sugar in your system, but the body is unable to use it. So you are starving in the midst of plenty. And these are some few symptoms that you may have about it. Or you may probably have poor wound healing. You have a wound and it's failing to heal. Probably, it may be that you have diabetes, or you have frequent or severe infection, a lot of skin fungal infection on your skin. You may have a lot of urinary tract infection that is happening repeatedly, or you have vaginal infection, which is happening repeatedly, or very severe ones, which shouldn't have been the case, but you realize that you're having that. Probably you have diabetes, and so you need to have it checked. Now, what are the effects of if you have diabetes, all right, which means your sugar levels are very high? What are the effects? I decided to group this into acute and then chronic. Acute in the sense that this one, it will present promptly, it will present as emergency that you need to do something about quickly, otherwise you may lose the patient. Or chronic, where it takes a very long time for you to have those symptoms. And what are some of these acute one? There's something we call diabetic ketoacidosis or hyperglycemic hyperosmolar state. What simply this means is that your sugar levels are so high to a certain level that your body is unable to contain it, and it causes a lot of problems. You may vomit, you may become unconscious, you may sweat a lot, you may become dehydrated, okay? And you may probably have a seizure and stroke, or something that looks like a stroke. You may have it as such. And the hypoglycemia usually is as a result of the medication that we give to treat the diabetes. If it is not managed well, then you can have hypo, sugar levels being very, very low, and also can give you a lot of fainting, sweating. You may actually collapse, and if nothing is done about it quickly, you may pass on. Then chronic, this is when the sugar levels are high over a long period of time, okay? You may have a stroke, heart attack, you may have your kidneys being affected, you may have your limbs, okay, being affected, you may have a sore that fails to heal, you may have some numbness in your feet, you may have your eyes being affected, okay? What we call typically diabetic foot also may happen because there's a sore that you are unaware about. Then importantly, it may also lead to sexual weakness. Now, this sexual weakness is mainly due to the hyperglycemia or the high level of sugar. Okay, that may also cause sexual weakness, but not really as a result of the medication, as opposed to the hypertension, where the hypertension itself, together with the medication, can lead to sexual weakness. Now, how do we diagnose someone who is diabetic? All right. If you are fortunate, you may have symptoms. If you are not, you may not have any symptoms at all. Whatever be the case, if you have symptoms that I have mentioned about urinating frequently, losing weight, you are eating a lot but losing weight, you feel tired most of the time. If you have those symptoms, together with any of these 3 labs that I have mentioned, where we call something fasting blood sugar, all right? Fasting blood sugar means that you haven't eaten overnight for about 8 hours or more, and then your sugar is checked in the morning. If the sugar level is more than 7, okay, millimoles per liter, just keep in mind 7. If it's more than 7 or it is 7, it's likely that you have diabetes, or the sugar level is equal to or more than 11.1. That is during the afternoon, or you've eaten. And this is a special test that is done where some amount of sugar is given to you, and then 2 hours later, your blood level sugar is checked to find out how much sugar is in there. If the level is more than 11.1, the chances are that, yes, you may have diabetes. That is, if you are using this together with the symptoms that the patient has, or you have something we call hemoglobin A1C. It's a chemical or it's a substance byproduct of high level of glucose in your blood. Okay, if it is also more than or equal to 6.5%, yes, it may tell you that. Now, if you don't have symptoms and now you do these labs, okay, and you have 2 abnormal labs, okay, that may also mean that you have diabetes, i.e., if fasting blood sugar is done on 2 occasions and they are all abnormal, likely you have diabetes, or you do fasting blood sugar, or you do 2-hour plasma glucose and both are abnormal, all right? It's likely you have diabetes, or fasting and then hemoglobin A1C and they are abnormal, the likelihood that you have diabetes. Now, this is the normal range, okay, that we have. But from this slide, I think what I want to focus on is the pre-diabetes value. Now, you realize that the fasting blood sugar here is 5.6, all right? It is not in the diabetic range. But when you have ranges within this pre-diabetic, it means that you need to start working on your modifiable risk factors so that you don't quickly develop diabetes. And so this is also very important. Don't just say that it is normal, but I mind in the pre-diabetic region. And so it is important that we take note of this as well. Now, other investigation that will be done for you will be to find out whether you have other comorbid condition or complications such as hypertension, high cholesterol level, kidney disease, or you have eye problem, okay? The time that you are being diagnosed of diabetes, you could probably have the diabetes for years, but you are not aware, and you could have complications. And so it is important that it is picked at that time. Now, how do we manage diabetes? All right. It involves a lot of specialties, eye dietitian, it involves even surgeons, physicians. A lot of people need to play a role in this. Importantly, we need to look at our lifestyle modifications, such as taking in a lot of high fiber diet, low fat diet, low carbohydrate, physical activity, engage in physical activity. If you take tobacco, it's important for you to stop taking tobacco and stop taking alcohol, all right? Now, together with this, there are some medication that can be used. This lifestyle modification may help to bring down the blood sugar to some extent, and then lower your blood sugar level with medication. In medication, there are some that we take in by mouth, and there are some that we need to inject, okay? Insulin is one of the ones that we do, but there are some other injectables. We need to take those ones as well. And then in terms of management, we need to look for the risk factors, i.e. hypertension. We need to look for comorbidities, all right? Hypertension, high cholesterol level, and treat them as well as look for complications, screen for complication, and treat them as well. One of the complications that I think I want to focus on this presentation is foot ulcer, okay? Because I feel it's something we can easily do at home. All right. And then when you get to the hospital, you can alert your healthcare personnel or your doctor. Now, foot care simply means that make sure you do things that does not make you get sore, okay, wound on your leg, because once you get it, it's difficult for it to heal. Sometimes because of the diabetes, you may not even feel a pinprick. You may step on fire and you may not even see it. So it is important that every day you need to wash your legs. Probably you wash it when you are bathing. Thoroughly look at it, and then when it comes, you dry it, especially in between the toes. Make sure you dry every place, and then look at your leg. Are there any blisters? Are there any? Is the one place colder than the other? Is one place warmer than the other? Take your time. Open the toes, the spaces over there. Inspect to see whether there is any sore, okay, happening over there. And when cutting your nail, it is preferred that you don't. If you can file your nail, it is better, because sometimes when cutting, okay, you may cut yourself, but you may not notice it because of the effect of the diabetes or a complication of it. And then make sure you keep the skin dry, okay? So sometimes you may have to apply cream on it, but make sure in between the toes, you don't apply so much cream there, because it keep it moist and then you may have infection. So this is it. But what I want to point, I know the one people will easily forget is the toes. Make sure you inspect in between the toes very well. And then take a mirror, look under your feet, inspect it. And then whatever you see, when it gets to the health worker, you probably alert the person. Try as much as possible to avoid walking barefooted. Now, how do we prevent it and control diabetes? Quite simple. The lifestyle modification. It's important that we pay attention to that. This we have mentioned over and over again. It looks simple, but it takes discipline for us to be able to do it. You must be able to achieve and maintain a healthy body weight. Okay, so don't be obese, don't be overweight. And the best way to do that is something we call the BMI. You can check that and look at it on the net to look at what it means. You have to be physically active. Okay, you are diabetic, but still you can be physically active. Engage in moderate intensity activities like walking briskly, riding a bike, taking some swimming. I mean, these are moderate intensity activity, just to keep your blood sugars under control. Eating very well, avoiding tobacco, cutting down on alcohol, and then salt intake. You need to cut down on that, because then you are reducing your risk of developing hypertension, which may further worsen your diabetes. All right. Now, there are some things that people have said about diabetes. Are they really true? Okay, so our next two slides will address that. Okay. People say that no one in my family has diabetes, so I won't get diabetes. Is that really true? Now, we mentioned modifiable risk factors. It may be that yes, there's no one in your family who have diabetes, but if you don't eat properly, if you don't exercise, if you're taking in a lot of alcohol, smoking, the chances are that you may have diabetes. So the fact that no one in your family has it doesn't mean that you will not have diabetes. Now, somebody said that I eat a lot of sugar, so I'm worried I will get diabetes. Now, let me make this point. Eating sugar does not cause diabetes. Eating sugar does not cause diabetes. The best, what it can do is that, eating a lot of sugary things, sweet things, will make you put on weight. And that weight is what is a risk factor for developing diabetes. And so if you eat sugar, it doesn't mean you will get diabetes. All right? Okay. So I was told I have diabetes. So now I will have to eat a special diet. Well, yes and no to some extent. Diabetes eat food that everyone is supposed to eat. Okay, every food that any food that everyone is supposed to. You just have to speak to your healthcare worker or your doctor so that you can be taken through how you can do this without necessarily causing a lot of your blood sugar to go up unnecessarily. Okay, all right. Now, I have diabetes, so I can never eat sweets. Yes, people say that, yes, I have diabetes, so I can't, they say I shouldn't eat sugar. That is true to some extent. But if you really understand your management and you speak to your doctor, there are sometimes, especially those who are on insulin, There are sometimes, if you think that you're going to take sweet, then you may be educated to take more of the insulin injection. But speak to your doctor. To some extent, it's not true that you can never. You may take it, but yes, we advise people try as much as possible to avoid the sweet because they really increase your sugar level quite quickly. And then it is not safe to exercise with diabetes. No, 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 no. You can't actually exercise with diabetes, okay? It's just that when you exercise, it increases the response of your body to this insulin. And so your sugar level may fall quite low. So once you're able to discuss with your doctor how you're going to exercise, you can be taught when and when not to take your medication. And if you're going to engage in exercise, maybe reduce some of your medication to a certain level. So yes, diabetic can exercise, okay? My doctor puts me on insulin. This means I am not doing a good job managing my blood sugar. No, that is not really true. Diabetes is a progressive process. It's a progressive chronic disease. And so there are people who have type 1 diabetes. Those people, they will not do well if you give them oral medication or medication that they need to take by mouth. They need to get insulin. They need to inject them with insulin. And so the fact that you are taking it doesn't mean you are not managing it well. All right. Okay. Now, importantly, some will say that I have a borderline diabetes, so I don't need to worry. I mentioned earlier pre-diabetes, where if nothing is done about it, i.e., looking at your modifiable risk factors, lifestyle modification, you may develop diabetes. So you need to look at that as well. All right. Now, I can stop taking diabetic medication when my blood sugar is under control. This is the temptation. People take medication for quite a while and they realize that the sugar level is normal and they are tempted to stop. If you are doing the lifestyle modification and your blood sugar is under control, yes, medication may be stopped temporarily. But you need to understand that diabetes is a progressive disease, and over time, the sugar needs to be monitored. Okay, the sugar needs to be monitored, and you may one way or the other need the medication subsequently. And so, if your blood pressures are controlled on your medication, it is not time for you to stop. Discuss with your healthcare personnel or your doctor about the way forward. It's very important. So, for the past 30 minutes, I've been talking about diabetes, and we said diabetes is a medical condition with high blood sugar or high blood glucose level, which has very serious effects on our body, on the kidney, the heart, and the brain, our legs. It may cause blindness. The incidence is increasing everywhere, but more especially in low and middle income countries, okay? Type 2 diabetes is the most common. The main one, type 1, type 2, and the gestational diabetes, but type 2 is the most common form of diabetes we have in the world. Some common symptoms is that you may be drinking a lot of water, your throat may get dry, you may be urinating a lot and frequently, you may be eating a lot, but still you are losing weight. So, I mean, those are some of the things. Management is usually multidisciplinary, that involve a lot of people to manage your diabetes. Now, in managing its lifestyle modification, okay, it's very important, together with medication that you are given, either oral or injection, very important. Screening for complication and treating other accompanying disease, hypertension, high cholesterol level are very important in getting a good outcome. So in a nutshell, that is about diabetes. And thank you very much. In case you want to get in touch with me too, these are the contacts. You can get in touch with me. You can get in touch with Albert as well. And so Albert, thank you very much. You gave me 25 minutes, but I tried. So
you did well,
thank you
Dr.
very
Doc.
much.
You did very well. You did extremely well. Every single information that anyone needs to know, either as a health worker or as a layperson, on diabetes has been expatiated in this short presentation. Thank you very much, Dr.
Thank you,
Daniel
Albert.
Amonu. We
Thank you,
appreciate
Albert.
you.
Yeah.
What was very striking for me now, it's questions and answers time. So if you have any questions, please start putting it in the chat box, in the comment section, and Dr. Daniel will gladly answer all our questions. Truth is, during his myth section, he's actually answered most of the possible questions. But again, if you have other questions, please put in the chat box. And it's a free specialist consultation anyway. Put in the chat box and he will gladly answer you. What was very striking was the fact that you stated that every 5 seconds somebody dies of complications related to diabetes. That was very striking. That was very striking.
It's very common. It's very common. People are not aware, but complications of it, sometimes a lot of people don't know about it. By the time they come, a lot of complications have set in. And they were like, I wasn't sick, I was fine. Okay, so let's make it a habit. Regular checkup, okay? Regular screening. If not at all, once a year, check yourself, check your sugar once a year. It's very important. You may not know, you may not be diabetic, but you may be in a pre-diabetic range. Once you get that, you start working on your lifestyle modification, and it will go a long way to help all of us. Thank you very much.
Thank you very much. We so much appreciate. And then the economic burden of diabetes, the management, it's quite okay. Somebody has a question. Somebody who wants to stay anonymous has asked a question. I want to go to the gym and build muscles, but I'm diabetic. Any advice? Very powerful question.
Okay, so it's important to note the body type of this individual. 1, 2, to note the medication that he or she is on. Okay, 3, yes, that he or she is on. Now, the most important thing is that, see, going to the gym is very important. Building your muscle, important in its way. But the most important you need to think about is, have you lost weight to some extent? Okay. Are you obese? Focus on you keeping your weight within the normal. Okay, keeping your weight within the normal. You can go to the gym, build your muscles and everything, but have a discussion with your doctor. Let's know the medication that you are taking, because once you get to the gym and working, I mentioned that your body's response to insulin is that the insulin is able to work more effectively once you are exercising. Okay, the body responds to it more effectively. And so it's able to bring the sugar down effectively when you are exercising. And so if you don't take the necessary precautions and you go to the gym, you may be exercising thinking your blood sugar is level, but because of the exercise and the insulin that your body is responding to very well, the sugar level falls too low. And then you have what we call hypo. And that is what we don't want. It is not a nice experience. And so you will not want to have that. Yes, you can go to the gym and build your muscle, but have a discussion with your doctor. Have a discussion with your health person so that your medication can be tailored to your need. Okay, very important.
Thank you very much. That's what we are trying to advocate for. Don't just do anything because you want to do them. Don't just listen to people who are non-professionals. We are advocating for accurate medical knowledge and the need to consult your healthcare professionals every step of the way. Thank you very much. Now, another question, very, very popular. Doc, is it true that if you want to know you are diabetic, you should taste your own urine?
Okay, all right. I saw it and I started laughing. It's a very common thing. All right. It's a crude way. It's a crude way of checking, but we'll not advise that. Okay. There are sometimes you may check you may even taste your urine and it's not sugary, but you may still be diabetic. So that if you are checking it and it's very sugary, I mean, you know that there's a serious problem. So it is not something we will advise. And so the question whether it is true, yes, when it tastes your urine and it tastes sugary, most likely you may have diabetes. But now there are medications that, I mean, make people lose sugar in their urine. And so you may also taste it and it may be sugary, but it doesn't mean that you have diabetes. The sure way is that we check your blood level, and then based on the value we get, we're able to tell whether you have diabetic or not. Okay, thank you.
Okay, so doc, you mean by the time you taste your urine and it's sugary, it means the thing has gone pa?
Well, that may be yes, it may be like that, or it may be that you don't even have diabetes, because I mentioned that now there are medications that usually make you lose sugar within your urine, and so it may also taste sweet, but it doesn't necessarily mean that you have diabetes. Sure, we check your blood level, get to the hospital, let them check for you.
Okay, so a second question from the lady Linda, and now she's asking again. Doctor has answered this one, but again for those who join us late, she's asking if you take a lot of water during the day and at night you urinate frequently, should you be worried?
Okay, so if I want to answer it strictly, like this, no, I don't think so. During the day, once you take in a lot of water during the day, and your body realizes that you don't need that amount of water, then the wisest thing the body can do is that get rid of some of the water. And best way is you are urinating. Okay. The other way is when you exercise to sweat a lot, but you are sleeping, you can't exercise whilst you are sleeping. And so the best way is that you be urinating it. However, once you are urinating frequently, but the most important, a lot of urine, you're urinating frequently and it's a lot. And you realize that even in the night, your throat gets so dry, you have to wake up to drink water. Okay? You realize that you've eaten a bowl of 2 balls of kinky. Within the next 30 minutes, you are so hungry. You're eating and then you are losing weight. Then you should be worried about it. But just night urinating because you drank a lot of water during the day, no, not really. You shouldn't. You shouldn't. But like I said, it's good to always do regular checkup once a year.
All right, thank you very much, Doc. Go to the summary slide. Let me see something. I want to just okay. So gestational diabetes. Somebody might ask, should I be excessively worried if I'm diagnosed? It's one of the 3 that you mentioned. If I'm diagnosed diabetes in pregnancy.
Okay, so I mentioned that because of the state of pregnancy and a lot of hormones that are produced, they work against insulin. And insulin's primary effect is to bring down your sugar level. But these hormones, as it were, bring your sugar levels up. Okay, when it gets to a certain level, it has effect for the mother, it has effect for the baby. That is how come we need to pick it up and treat. And I also mentioned that most of the time, before, after you've delivered, your sugar level, because those hormones are not there, but those, your sugar level go back to normal, and you may not have to be on medication. But for some people, the sugar level will not go down. It remains high like that. There are some that the sugar level will go down after delivery. However, their risk of developing frank diabetes, especially type 2 diabetes, is high. It doesn't mean that necessarily you will have that diabetes. And so once you've been told that you have gestational diabetes, I think the most important thing to do is look at your risk factors, okay? Most especially your modifiable risk factor. Look at your weight. Are you obese? Are you exercising regularly? Have you been taking alcohol? Have you been smoking? And I mentioned last week, not just active smoking, passive smoking, especially secondary smoking, is also important. Look at all those things and then try and modify it. It may reduce your risk. But the fact that you have gestational diabetes does not necessarily mean that you will continue after you deliver. But definitely your risk is a bit increased than somebody who doesn't have that.
All right. If you have any question, please feel free to put in the chat box or in the comment section. Dr. Amawonu will gladly answer. Doc, again, another thing that in my practice, those that I've come across, amputation. I know there's a surgeon on the call as well. Most of the people that I have come across who get amputated, most of them have one way or the other have diabetes. What would you have to say about that?
Okay, Albert, thank you for that. It's a worry. And that is most like, and I thank you for this platform to educate people on it. And so in my presentation, you realize that I noticed people have that problem a lot. And so I try to focus on one of these prevention that we can do, okay? Now, diabetes, because it affects several parts of our body from head to toe, okay, over a long period of sometimes you may have something we call neuropathy, where your nerves are affected to some extent, such that you can't even feel something touching you. You can't feel pain, okay? You can't feel it at all, okay? And so you may even step on a nail. You are not aware of it. You may step on fire. You are not aware of it. Some people may try to maybe have a sore. They may put their leg in hot water in order to treat their leg for whatever reason. And they may not feel that the hot water is burning their leg. They may not know at all. There also, because of the high level of glucose or sugar in your blood, okay, the slightest wound that you have or thing, that the bacteria, that is what they like. They like that sugar to be able to also grow. And so once they are growing and manufacture, or they are growing and multiplying, it's difficult to control. And so it is important that, yes, it is not only in the hospital, even at home, this basic thing, looking at your leg, taking care of your leg, inspecting it every day is very important, so that once you notice something small about it, you see the expert, and therefore then you can be managed appropriately. There are some people who are wearing slippers. They are walking about, and the slippers get off their leg, and they are not aware of it. It's because of a complication, and so they may step on some broken glasses and things, and they are not aware. Okay, so it is important. This simple thing can save a lot of people. All right, can save a lot of people. Once it gets unnoticed, over time, it gets too bad that the leg has to be taken off. Otherwise, the patient will lose his or her life.
Yes, thank you very much. So, foot care, like as you said it's the part that is very striking for the rest of us who may not be medics is that he mentioned it. You may not feel any sensation. Imagine putting your foot in hot water, but you don't feel it. Imagine something cutting you, something biting your feet, but you don't, something cut you, but you don't feel anything. That is how come it will be there faster, and then before you know, the wound is increasing and all that's happening. That is why when you know you are diabetic, there is a special thing you have to do. Foot care is a whole thing you have to do. You take care of your foot, because for your legs to be amputated, it starts from the foot. That is why I wanted Doc to go over it again, and he has a whole slide in that regard. So foot care for all diabetics is very, very key. All right, thank you very much. There is a question
Okay.
that says,
Yes, before you go on,
okay,
just let me. There are some people, not necessarily that you don't feel the sensation. You may feel it, but it is reduced, and so you may put your leg in that hot water. You think that, oh, the hot water is just okay, but really it is hotter than you think, and may burn you. But you are just feeling it's lukewarm. Okay, so it is important that once you're doing this thing, inspection is very important. Examining your leg is very important. I thought I should mention this as well. Not just absent, but reduce as well. Very important.
Thank you very much for clarifying first. So either you feel it lesser than you should, or you don't feel it at all. So the point is, once you have diabetes or whatever, you have to take very good care of it to avoid the amputation. It's very extremely common. Most of the people who have their foot cut, their foot or their legs cut, mostly it's because of diabetes. Okay, so then there's a question from Linda. And Linda, I know you're doing very well, very well. What she says, if a baby is born with diabetes, is there a risk that that baby may end up going blind?
Well, I would say if a baby is born with diabetes, can he or she go blind in an okay, well, if the child has diabetes, okay, and the diabetes is not controlled, that baby, as well as anybody with diabetes, can go blind. Yes, it is possible. especially if the sugar is not controlled. I mentioned that it has effect on your eye, okay? And we've mentioned the effect of diabetes, and blindness is one of them. It doesn't matter whether you're a child or you are an adult. Once the sugar is not controlled over time, it's possible, yes, you can go blind. So that baby can, if the sugar is not controlled.
All right, thank you very much. Anybody has any other question, please feel free to put it in the chat box. Dr. Amawonu will gladly answer all the questions. He will gladly answer all the questions. If you have any question, please feel free, put it in the
Let me, or if he's saying that the person has diabetes at birth, and can that person be blind, as in at birth? I don't know whether I'm looking at the question in that aspect as well, whether the person can be blind at birth. I wouldn't say so. If the person is blind at birth and the sugar level is high, it may not necessarily be because of the diabetes. Maybe something else is causing the blindness. It needs to be looked at. There are some infections within while the child is while the mother is pregnant that may have led to the child being blind at birth. All right, okay, and there are some risk of developing diabetes as well. So this is looking at it from the other angle as well. But over a long term, while that child is growing, yes, there's a possibility that the child can develop blindness if the sugar level is not controlled.
All right, thank you very much. We have a few seconds more to go. I've just launched a poll. Those of you who are willing, just answer the questions in the poll, and we just to see what's going on. Thank you very much, Dr. Daniela Moni. If anybody has any more last-minute question to ask, every information we all need to know about diabetes has been presented over 30 minutes, and questions have been answered. Even before we started the questions and answer section, and we've had interesting questions that has come through. If you have any last-minute question, please feel free to put in the chat box or in the comment section on YouTube, and we'll gladly answer you. Very striking thing that came out very beginning of this presentation is every 5 seconds, someone die of complications related to diabetes. That should make us all wake up. Every 5 seconds. That is serious. So we all need to, and Dr. Amonu advises at least annual medical checkup. Annual medical checkup for all of us. If there are no questions, I want to say thank you very much for making time. Thank you very much for making time. I've just launched a poll. Feel free to answer the questions. And feel free to always recommend this Weekend Health Talk to your friends when it is advertised. And of course, the recording will be shared on the YouTube channel. Feel free to visit to play back and, of course, go back to watch and play back the previous ones. Last week, we had a presentation on hypertension. My last question for Dr. Amono is this. Would you say diabetes is much more dangerous than hypertension?
Well, I will not want to go into that argument. All of them are dangerous. Once they are called silent killers, they are dangerous. See, this thing, I don't know, I won't answer that yes or no. Both are dangerous. Even though they are dangerous, I must also say that there is help, there is treatment.
Yes.
That is the most important thing. And if you manage it well, you can live quite very, very well. I mean, you can live a normal, very normal life. And you need to take your medications as well. I mentioned something last week. I think some people got in touch with me about the sexual weakness of hypertension. I think let me just use this opportunity to address that. So you see, hypertension, the hypertension itself, right, can lead to sexual weakness, especially for the men, as well as the medication. And so if you are having hypertension and that, the most important thing is have it controlled first. Once you have it controlled and you're still having problems, it can be looked at for you. All right. I mean, this is just to chip it in and not to overemphasize on that. So both condition, silent killer. Silent killer, you should fear it. But there's treatment for silent killer. All right.
Yes. Yes, yes. All right. Thank you very much. Since there are no questions in the chat box, thank you. Okay, there's a question. Are there supplements recommended for diabetes? There's an anonymous attendee. Okay. And how many months can you recheck your diabetic status? These are two questions, two last minute questions you answer for us. And we
Could you
ask.
please ask the questions again?
Are there supplements recommended for diabetes?
No, there are no known supplements that I know, but people tend to have supplements that they take, and it is look at case by case. I mean, whether they are okay for you or not. Okay. Once anything we are taking supplement that we know will not worsen, okay, your condition, and it's going to help in boosting your immune system. Why not? Yes, they are. But I can't say that there's any particular supplement that will give to diabetic or hypertension, but it will be looked at case by case. And then the other question is how many months can you recheck your diabetic status? Well, it's varied. If I understand the question properly, it's varied. You need to look at your risk factor. Okay, if you're somebody who doesn't have family history, you don't seem to have all those risk factors, there is no need checking your blood sugar every month or every 3 months. There may not be a need to do that. Okay, or you're young, you may probably do that once a month. But if you assess yourself and you realize that no, I've had an issue with gestational diabetes. Okay, I'm overweight, I am not physically active, then the recheck could be probably frequent. Maybe every 3 months, it will be a good thing to do, to check it, your sugar level. But I will not say categorically that maybe 1 month, 2 weeks. No, it will be looked at case by case, considering your risk factors as well. Very important.
All right, thank you very much. On that note, please join me say a big thank you to Dr. Daniel Amanu, physician specialist, who's made time to share this. He's talked to us on hypertension last week and this week on diabetes. These two in the medical world are silent killers, and the two of them we should be afraid of, and you should try everything as much as possible to prevent them or have them well controlled if you are diagnosed to have them. Both of them, we all realize that over 50% of people who may have both of them are not even aware they have them. That is why they are silent killers. So let's be on the lookouts, regular checkups, and compliance to medications. Of course, for the men, both of them causes erectile dysfunction, not just the medication. Both of them causes erectile dysfunction. So it's in your interest to first of all have them both under control. Then you talk about which medication is appropriate for which one and which one. That one you discuss with your healthcare professional. Don't do anything that other people are advising you to do. Just discuss with your healthcare professional. Once again, thank you very much, Dr. Daniel, for making time to share with us your knowledge free of charge. We appreciate it. And of course, thank you every one of you on Zoom and on YouTube. I appreciate you once again. It's been a plum pleasing pleasure serving you all.
Thank you very much, Albert. But I think there's a question that has been asked that I just want to quickly address. Can I check my kid's diabetic status? Yes, you can do that, especially when you realize the risk factors in them are very high. So please, you can go ahead and do that. I believe there's a reason for you asking this. Either the parent are diabetic, but I don't know how old the kids are. But yeah, there are kids that have diabetes, especially type 1, where insulin is not being produced. So if they are having the symptoms, please go ahead and check them, okay?
Yes.
Speak to your doctor, speak to your health personnel if there are any concern, or you can get in touch with me as well if there are any concern. Thank you very much.
All right. If you're on prescribed medications, I recommend Cellgivity and Max 357 for most of my friends. Specifically, the supplements I recommend, and from me specifically, Cellgivity and Max 357. These two work in addition to your prescribed medications. They are good, tried and tested, and they are very, very effective. In addition to your prescribed medication, they are supplements They're not drugs, so they work in addition to your prescribed medications to help you have your sugar levels under control and your general health, your immunity, to take care of all that as well. Thank you very much, every one of you, for making time. Next week, we will come your way